go, Gilbert. We are live with another Go Gilbert Business Spotlight. We're so happy to be here. And for those of you who haven't seen, we are spotlighting small businesses in Gilbert. That way we can get a face to a business name and really support the community during this time and always. So we are here with Ashley with Prime Direct Health. Hi, Ashley.
Hi, thanks for having me.
Yeah, happy Monday.
Happy Monday.
For those of you who weren't sure what day of the week it is truly Monday, May 4th.
Right.
2020. What a great year. So Ashley, tell us a little bit about Prime Direct Health. What do you offer and kind of just a little bit about the business?
Sure. So we are a primary care clinic in Gilbert on the corner of Warner and Lindsay. And I just don't bill insurance. I take cash for my services. It is a membership-based program. So I operate under a platform called Direct Primary Care, or DPC, as you might hear me say. And the patients just pay monthly. So there's a flat fee for everything. The way my clinic does it is I don't generally charge for procedures. Every once in a while, there's a lab that comes in that's a little bit extra, but for the most part, we do routine labs that are included with that fee too. People come in whenever they need to. There's no extra cost for office visits. There's no cost to call me. People can call me anytime, text me, email me anytime. I'm very available to them.
Awesome. So what are the types of things that your patients come in to have done? Is it kind of the well visits or like a yearly? Oh, and then look, it's on the screen. Love it.
Yeah, so people come in for anything and everything you would go to your normal primary care doctor for. So I'll do physical exams. We do, like I said, the routine blood work that they need. I'm the one that draws the labs actually, so it takes no time at all. They like that. People will come in for procedures all the time, joint injections. I have an EKG machine. We've got a breathing spirometry test here for asthma or, any breathing trouble you have. There was a lot of coughing going on in January and February. And anything that you can imagine that you would need your doctor for, you come in.
Awesome. So it's just a flat monthly fee. Is that correct?
That's right.
Is it same for everybody? Or is it changed depending on age or maybe your health history, things like that?
So for adults, it's $100 a month, flat fee. For kids, it's $50. For whole families, if you want to talk about having a family plan, we haven't broken that down yet, but I'm willing to talk. And actually, we wanted to say that if you're watching this video and you call me and you mention it, we're going to offer you just your first month free. Just come in and try it.
Awesome. I love that. So $100 and that covers, I just think it's so cool because being a small business owner, as I am, and I know lots of people are, insurance has not always been the easiest thing, not only to get, it's super expensive. And then when you do get it, they don't cover so much. So right. I love the business model that you have because it makes sense, especially for someone, that I don't get employer covered, coverage insurance. So.
Right. It's actually popular with small business owners because of that. I have a couple of realtors, pool cleaners, hairstylists, people like that who either operate on their own or are owning a small business with a couple of employees. We have a couple of businesses with around 10 or less employees, but they actually front the bill for those employees. And so it's a benefit in that way. It's not health insurance. It's not a health plan technically, but it is a way to get access to great primary care.
Sure. I would think that would be a huge value add as a small business to offer that to your employees. I love it.
Mm-hmm. Yeah. I mean, the cost of healthcare insurance is around $15,000 to $20,000 for a family these days for an employer-based plan. And for, I think, an individual, it's like $6,000 to $8,000, sometimes $10,000 a year. And so if you were to think about how much you could save by joining a clinic like mine at $100 a month, $1,200 a year, or, perhaps, twice that for a couple, maybe a little bit more for a family, you're saving a lot. And there are health cost sharing organizations out there too that will cover emergency care, which some of my people are doing. And you can get plans for anywhere from 170 to 200 for an individual to 500 for a family. And so you combine the two, you're set.
Yeah, that's awesome. So how long have you guys been open?
We have been open only since September of last year, so a little under a year. And yeah.
Perfect. Okay, so we have to talk about it. What are the changes your business has had to make in light of COVID? Have things changed? Are you changing the way you operate?
So because I'm a smaller clinic, I haven't changed a whole lot.
Sure.
I'm not seeing people with coughs and fevers in the office to keep it clean.
Okay.
But because I can see one person at a time and flow is, so I only see up to like 8 patients a day, just because it's super easy for me to do it that way. I'm not, I don't operate on, making 20 to 30 people come through here. Right. So I have plenty of time to clean between patients, and people are coming in as usual since we're an essential operation. I do work a little bit with Gilbert Center for Family Medicine. They're the ones who opened this clinic with me. And we'll do a lot more telemedicine visits over there, lots of precautions with PPE masks and all that and stuff. And I'll wear a mask here also when people come in if they need me to. And but not a whole lot has actually changed for me in this clinic. Yeah.
Well, when you mentioned 8 patients a day, to me that immediately makes me think that you're spending more time with your patients than going to a larger clinic, and you feel like they're just like, shoving you through the door, just, what am I trying to say? Like almost like on a conveyor belt. Okay, next. Okay, next. Okay, next.
Right. So this is not a must, but on average, people will spend about 40 minutes with me. And I think that's just because they can.
Sure.
We just chat, and I'll take care of any and everything in one visit because I have the time. But I've had people come in for quick visits, like, that I already know, and they'll be in and out the door in 5 minutes because, they had a UTI or something. We tested them, got them the medicine they needed, which I have in the office too at wholesale prices. And they were out the door in 5 minutes.
I love it. So if you need that extra time, it's available to you. But if you're in a hurry, you're set up to do that too. That's awesome. Yeah, well, I don't know if you've noticed as we're doing the video, you're getting tons of love. You're getting tons of love. People have lots of great things to say about you.
Great.
Yeah, it's super fun to read, like flashing across the screen.
Oh, good.
You're doing something right.
What's that?
Things right.
Oh, yeah.
Well, I'm super happy to learn. It's funny when we do these interviews and these videos. I love it because it's like, I hadn't heard of your business, but like it's something that I think is huge for the community and even for our business. So I love that.
Yeah, thank you. It's a real benefit for, especially, I think, small business owners, because there are a lot of people that I've met in the community that don't have insurance, period, and they would just like care. And so it's a great option for them.
Well, and then I'm thinking, so kind of what we have is that catastrophic. So it's affordable, but yet it doesn't cover any of the services you provide. So that's out of pocket anyway. So to be on a plan like you have, I feel like I'm no healthcare professional or insurance professional, but in my mind, I'm thinking sign up with a subscription membership at your office, and then maybe have that, catastrophic, if something catastrophic happens, because that insurance is still affordable, right? But it doesn't cover all this stuff. So, there's plenty of times I'm like, oh, do I really need to go to the doctor because it's just so expensive? But if I have something like you offer, maybe I'll just come every day if it's $100. Like, wait.
You say that, but I've had a lot of people say to me, I don't go to the doctor, but maybe once a year or never go. But then they sign up for a membership with me, and then they're in here every other month at least, And so it's just because I think the service is available, and I get along with every patient I have. I can't say that I've not gotten along with anybody yet. And so maybe it's the relationship. It's easy to come in, but they end up using the doctor a lot more than they thought they would.
For sure. And maybe, you know, they can nip something in the bud instead of suffering.
Right. Mm-hmm.
Well, I am so glad to meet you and your business. And I know if you haven't heard of Prime Direct Health, you've heard of it now, and it's something that I think everyone's going to really want to check out. And then if people have questions, is it okay if they comment below?
Absolutely.
Follow that thread. That would be awesome because, you know, some people are afraid to ask it live.
Sure. And call me anytime. That number that you see on the screen, that's me. So I'm the one who answers the phones here. So if you have any questions at all, feel free.
What are your hours?
I'm here 9 to 5 pretty much every weekday.
Okay.
And people are able to get a hold of me after hours if they need to. I ask that they respect those after hours, but I'm in the office pretty much 9 to 5 every weekday.
Oh, so
you can read out loud.
Oh. Mike's like, I'm reading. He's like, oh, we got another post, and I forget. So this one, our family has been with Dr. Ashley for almost 6 months and never been disappointed. She's amazing for my son who has suffered from chronic ear infections and was incredible when I injured my leg at the gym on a Friday night and needed stitches.
I love Sherry. Hi, Sherry.
I love it. So I can't wait to meet you in person. Thanks again for being here.
Thank you so much.
It was so nice to meet you. And go Gilbert, Prime, Direct Health, Lindsay, and Warner. Check her out. She's amazing. I already knew this. And actually, I'm not sure if you knew, but me, myself, and I am a realtor. Go Gilbert, #1 realtor. So if you're looking to buy or sell a home, give us a call. We would love to interview for the job. Happy Monday, everybody. Have a great week.
Bye.
Thank you. Bye. See you later.